Hello everybody, I am Dr. Suraj Muralidhar. Today we will be discussing about a very important topic, that is undescended testis, medically called as cryptorchidism. If you are a parent of a male baby or if you are planning to be one, you should know about this, which is very important. During development, the testis is formed inside the abdomen and it slowly descends down and it goes into the scrotum at birth. Many a times it will not descend into the scrotum and it will remain inside the abdomen, and this is called as undescended testis. It is usually seen in about 3% of full-term babies and about 30% of preterm babies. So what happens is, usually in case of a preterm or an intrauterine growth retardation, and in such conditions, before the testis descends into the scrotum, the baby is born. So in such cases, it is very important that at birth you need to palpate the scrotum and examine the scrotum whether both the testes are present or not. Many times, it spontaneously descends into the scrotum within the next 6 to 12 months. So it is always advisable to wait for the next 6 to 12 months to see if the testis spontaneously descends into the scrotum, and only then we need to plan for the treatment. Sometimes in case of hormonal imbalances like low testosterone, a testosterone supplementation might be required, but however most of the times it will be normal. So coming to the treatment, usually what happens, once we palpate and if we are not able to feel for the testis, we confirm it by an ultrasound or an MRI scan, wherein we get to know the exact location of the testis, the size of the testis, etc. We should not get confused with a condition called as retractile testis, where the testis comes down and goes up spontaneously and keeps moving, and this doesn't require any specific treatment, it settles on its own. Only in cases of undescended testis, we do a surgery called as orchidopexy, can be done usually laparoscopically, wherein the testis is brought into the scrotum and it is fixed into the scrotum so that it doesn't go back into the abdomen, and this helps in preventing a lot of complications. Some of the complications which can be seen in the cases of undescended testis are, one thing, it can affect the sperm production because of the high temperature inside the abdomen. It can also cause risk of malignancy, that is the carcinoma of the testis. So hence this surgery is very important. It also can lead to torsion sometimes. So orchidopexy if the testis is normal, and sometimes orchidectomy or removal of the testis if it is totally atrophic. So to conclude, I would like to say this undescended testis is not a condition where you need to panic or get stressed about. It is easily diagnosed and easily treatable. It doesn't have any long-term side effects if it is diagnosed and treated early, and hence do not panic and seek the treatment from your urologist immediately. Thank you.